Join Louisiana Right to Life in protecting the vulnerable as we share pro-life stories, insights, and news from the Pelican State. Welcome to the Pro-Life Pod.
Hey everybody, welcome to the Pro-Life Pod. My name is Ben Clapper, Director of Louisiana Right to Life, and I'm here to share with you about all things pro-life in the great state of Louisiana. We have a great topic and a great guest today that we're going to share with. We're in our new studio after we moved our office. Thanks for everyone's support who's been able to help us move into this new space. We can't wait to show you more of it in the coming weeks. But you know, an important topic that we discuss often is about infant loss, and especially those families who are grieving from the loss of an infant. You know, we respect in the pro-life cause every human person, especially unborn babies and babies who have lost their life soon after birth. And what we want to do is not only respect the dignity of that child, but also provide support to parents and families who are grieving from the loss of these beautiful, wonderful children. Well, today we have a champion with us in Louisiana who is really taking a lead on advancing the bereavement support efforts in this state, both through the hospital that she works at, but also statewide, and having a new law called Angel's Law that is passed that she's going to tell us all about. Kristi Lamarque-Bordelon is a bereavement nurse navigator at a local hospital in Covington, and is really doing an amazing job to support families and provide that respect to babies. So Kristi, welcome to the Pro-Life Pod.
Thank you so much for having me today.
Well, you know, we didn't really know each other until recently at the legislature, and you leading the passage of Angel's Law. So it's been great to connect with you and get to know you and see all the great work you've been doing.
Thank you so much.
Well, first, Kristi, maybe just tell us a little bit about yourself.
All right. So I am a nurse, and I have the privilege of, the last 10 years of being a labor and delivery nurse. But more recently, in the couple of last years, I got to be selected. That's what I like to try to say, is that a nurse, Barbara Tarjan, said that I really think you could be good at helping families who had lost babies. And I thought, that is the last thing possibly that I ever want to do. But I took that advice, prayed about it, and thought, this is the path that I really want to be on. So with that, I started cultivating a bereavement program at the hospital that I'm currently working at. And in those moments, I said, I really want to advance my training as a nurse. Went back to school, got my master's degree, and in between did some teaching. Taught at a local associate's degree program, Delgado Charity, and then taught for a little while at Southeastern Louisiana, and just enjoyed having that time with students and connecting and learning more about learning. So I'm passionate about learning.
Yeah. And,
all the while having 4 beautiful children and loving being a mom and a wife, and just getting to know who I am as a person. And it's all prepared for me for like moments like this.
Right. Well, you're busy, it sounds like. I mean, that's a lot that you're able to pack in there.
Yeah, absolutely.
Well, a bereavement nurse navigator. For those who don't know, tell us a little bit about what that is and what your work consists of.
So, it's kind of multifaceted of what we do on any given day. So if a family has come into our facility and they're having a miscarriage, we want to walk you through what's those next steps look like. What can you do when maybe you return back home and you haven't had a complete miscarriage with us, but how can we support you when you go back home? And then follow up to that. If you are having a miscarriage with us at the hospital and baby's a little bit older of gestation, do you want to meet that baby? Do you want to hold that baby? Do you want handprints and footprints and pictures? Do you want to spend time with baby being on a carrying cradle, which is a cooling device, so that parents get this gift of time? Then we also deal with families who have had a stillbirth, and stillbirth in Louisiana is anything that a baby that's still from 20 weeks and greater. And so those families, we want them to have the option. And that option looks like the carrying cradle. The carrying cradle, like I said, is a cooling device that families get to utilize, and it gives them that gift of time. Also, the handprints and footprints, the memory making things. We want them to have the choice of doing all the things. And I say to everybody, it's about the choice. It's about a family saying, I don't want any of that, or I want everything, and we want to support. We also help families that maybe their baby goes to the NICU, which is the neonatal intensive care unit, but for some reason that baby doesn't make it. We want them to have those options. Then we also have families that we will support in their baby may not they may have like a terminal diagnosis while in utero. So we want to support them through the course of their pregnancy. What does it look like? What does the next following weeks looks like? Months. And we want to talk to them about what are your birth wishes? What do you want that labor and delivery process to look like? What kind of time do you want with that baby? So it's very, we want to support individualized care so that those families feel like they're in control of the situation. We realize that it's the worst of times, but yet we want you to have some level of control so that you are getting to make some decisions.
Yeah. And this is something that is relatively new in the course of care in the hospital. When you say that?
Yeah, absolutely.
And I think it is a great step forward in respecting and caring for life and for the family that programs like this exist, because beforehand it was nothing like that. And people were really, maybe they didn't even see their child.
Right. So, when we think about it, I talk to nurses about this all the time. And it's also come true that, when I'm helping with families, there's a lot of times that the mom, so the grandmother, will meet me in the hallway and said, this has happened to me, but I never got to meet my baby. Or if I met my baby, they took my baby away in 2 hours. And, I can't believe that you allow all of this. This is so special, so nice and so kind that you are doing so much for my daughter or my son or whoever it is. And you think about just a generation ago, families didn't have these choices. And in many places throughout Louisiana and throughout our country, people don't have these choices. And it's really about, we need to make a standard of care.
Absolutely. And Kristi, this is personal for you.
Absolutely.
Tell me a little bit why it's personal for you.
So my daughter, Angèle Marie, we playfully called her Angel, passed away when she was 20 months old. And that moment just changes everything, right? Your thoughts of who and what everything would have been changes in that second. At the time, I wasn't a nurse. And I remember the nurses and the doctors, and, you kind of remember the great and the bad. And you take both sides and you go, wow, that person really impacted me for the rest of my life. And I thought, I want to be a part of that change. I didn't know at the time that I could ever be in the bereavement world, because I thought, oh, that's just some place that I could never deal with. But I wanted to become a nurse. I wanted to walk away from lucrative business that I was a part of. My family is a part of a very lucrative business in Louisiana. And I felt like this huge calling on my life to be a nurse. And then throughout the course of my time, I've walked through numerous miscarriages. I've walked through an ectopic pregnancy. And, at the time in those moments, you think, why on earth is all of this happening? And I really feel like it was God preparing me for such a season as this, that I tell every family that I meet, I don't know your grief. I don't know what you're walking through, but I know something very similar. And all I can do is stand next to you and say, I am so sorry for your loss. And of course, I always want to know their baby's name, and I want to know all the things they would have had prepared and all the things so that we can honor that baby. And I just remember thinking that in every loss that I've had personally, when people were willing to remember who my baby was and willing to say her name, it just impacted me for forever. So I think about that every time I meet these families, and I always want to know, who is your baby? Who is this little person that is going to be a part of your family for forever? Because my child, although she's not here with me, she's a part of my family for forever.
Wow.
Yeah.
And so when you were asked or summoned to be a bereavement navigator, I mean, was there hesitation or excitement, or and how does that kind of wrap in with Angel in your story?
I will be honest, in the beginning, I felt like there's just no way. There's no way that I will be able to calm my emotions enough to be in that room. And, I sit back and, I was just like, I can't do that. And I remember being at church on a Sunday, and there was a pastor. I think it was somebody that was doing missions. And, it was I think it was given the scripture about going out and making disciples of the world. And his prayer was, will you give God your yes? And I sat back in that moment. It was like something snapped. And I said, wait a minute. I have given God my yes to all of these other areas of my life. But this one thing that keeps coming back, I've not said yes to because I have too much fear. And in those moments that followed that, I was like, okay, God, I'm going to give you my yes. I'm scared. I don't think I can do this. But if you want me to say yes to this, it's going to work out. And amazingly, it has. I'm not saying that I don't cry and I don't get upset and all of the things, but I know that God meets me in this place. I know that before I meet any of these families, I'm praying beforehand and saying, God, just give me the words to speak. Let me be there for them in the midst of their hurt and their trials. Let them know that they are appreciated and cared for. And that is really what birthed, well, let's do better for bereavement.
Yeah.
And as we decided to start the very first support group on the North Shore, and I was starting to meet other families from other facilities, and I realized, wait a minute, the standard of care is not there. And not to fix blame on any one hospital system, I looked at it as more of a global problem that if someone is not putting attention on these precious little lives, then how can you know to do better?
Yeah.
And so that really birthed Angel's Law.
Wow. Well, when I hear your story and everything you've been through, it seems like what you're doing now is just completely what God had planned the whole time. But
Exactly.
you just didn't know it every step along the way. I
Every
mean,
single way.
your first decision to become a nurse seems like you were on this path, whether you knew it or not.
Didn't know it.
Yeah.
Yep. So true.
Well, so tell me what then it comes forward. So about a few weeks ago, Governor Landry signed Angel's Law into law in Louisiana. Senator Patrick McMath and Representative Kim Carver, legislators on the North Shore, led the bill for you. Why did you want this to happen?
Right. So I happened to be watching TV one day. I don't do a whole lot of that. And I hear this bill called Everly's Law in Texas. And I sat back and said, wait a minute. Wow, this is something that is so amazing. Kind of took the perspective of, because I'm a nurse, because I'm in the healthcare field, I had some very definitive thoughts of what could happen, should happen, and drafted some information down on, I'm sitting at my computer at my dining room table and thinking, okay, what could work?
Well, you were a nurse. You're a bit,
Right.
Yeah.
So I was like, okay, what do I do? And then finding who are my legislators. I remember voting, but who exactly I'm going to write this email to. So I pen all of this information along with what the cooling devices look like and what are these things? Because if you've never been in this world, you don't know what the cooling devices are.
Right.
And I sent an email to Patrick McMath, and I will say very quickly his staffers get back to me.
That's great.
And they're like, what are you talking about? And that's usually the response I get from people that, what do you mean there isn't a standard? And what are these cooling devices? That's usually the two big questions of how could there not be? It's 2026.
Right.
And so very quickly, the answer was yes, we absolutely want to carry this bill. And of course, I had my doubts, but from the beginning, Senator McMath was like, this is going to do amazing. It's going to be great. And I was like, I'm not sure. And he said, no, it'll be great. And the amazing part of it is that he didn't give me a whole lot of direction of what the testimony needed to be. I did a lot of praying about what needs to be said and what is the reflection of God here. And in those moments, I also was like, who best can I bring alongside of me to give her testimony? And that's how I picked Jamie Strahl. This beautiful mother lost her full-term baby. But for the fact that there was a cooling device, her family wouldn't have met her baby because her family lives in Dallas, Texas. So they got to meet this baby only because of the cooling device. So, we show up for the very first testimony and, I just said, God, you do, you can do. And, as we gave this testimony, Jamie gave her testimony. I don't think there was a dry eye.
No.
And Senator McMath, once everyone gave their testimonies that day, had to call for a little break because there was just an overwhelming.
It was beautiful. You could feel it in the room.
Yeah. And that being said, in that moment, it was like, okay, this is leading to somewhere amazing. I think people resonated with the thought of, why do we not give families these choices? Right. Why do we not give them the opportunity? They can say, no, I don't want to have time, or yes, I want all the time, and I want to have all of these memory making things. But ultimately, we've got to give people the choice to be able to do these things. And also, why are the facilities not having the cooling devices? So pushing forward every step of the way, we just get yes after yes, because once they heard what this was, every legislator was just blown away by wanting to be a part of it. And that's what was so special.
Right.
In the very last day of the House vote on the House floor, Representative Kim Carver carried it there. And it was so emotional because, I think no matter what you believe in, no matter where you stand with other things, this is so precious.
Right.
That these lives mean something to these families. Yeah. And, families I meet desperately want these babies. And yet, unfortunately, for whatever reason, the loss happens. So that's what was so sweet. And what was so sweet was seeing, across the House floor, people standing in just agreement that this is amazing. The House President de Villiers gave us the gavel saying, wow, you're the voice for so many. And so the gavel was given to me that day. And I just think, wow, just one little step of obedience, writing this email, not really sure what I was doing. And then look what we've changed. So now in the state of Louisiana, Angel's Law says that every hospital that has labor and delivery or a NICU, because there's 2 facilities in the state that are just standalone NICUs, not labor and delivery, they will have a cooling device. So if families want to utilize them, they can. Healthcare professionals are going to be trained. We're going to educate, make sure they're confident. That's part of, when you talk to nurses, physicians, part of the fear in this arena is that I just don't know what to say. So we want people to be prepared. We want you to be confident. Look, at the end of the day, there's going to be moments that there's things that we're just unsure of what to say. This is hard. Very hard. The third component was that we want to make sure that families have something in their hand for mental health. If you want to seek out care beyond our facilities, where can you find it? When you're in the depths of grief and depression, we don't want you having to Google, who can you see? Sure. We want you to have a piece of paper. Oh yeah, this is a phone number. This is someone I can call if I need some additional help.
Because not all hospitals are going to have a Kristi,
right?
There. Now, hopefully this is inspiring them to have a bereavement nurse navigator there. But in the event, at least that paper and that contact gives them a place to go.
Right. Exactly. Yeah.
Well, tell me a little bit more about the cooling cots for people who may just maybe put that together of, what is the cooling cot and how does it help a family?
Right. So there's 2 major different manufacturers in this space. One's a cuddle cot, one's a caring cradle. They essentially work the both same way. They offer cooling. Well, what does that do? Our body's natural progression once we pass away is that our body starts to change. So in years past, what we've always done is people need to go to the morgue right away. Well, what happens is that then those families don't have time with their baby. And we got to remember that in the labor and delivery world, you have 2 patients. You have the mother and the baby. So sometimes moms go through difficult deliveries. Maybe they're anesthesia. Maybe they're just a lot of pain. And so if you say to a mom, look, you get 2 or 3 hours and that's it. Well, she may still be sleepy from a procedure that was done, or maybe she's, in some pain still. Right. And then that time's over. And we're not giving any extra time. So these cooling devices, what they do is they essentially cool, and they allow baby to be in the room with the family, and they're cooling baby to a place where it stops some of the changes that begin to happen. And it allows for families to have that additional time. And I think it's really beautiful.
Wow. Well, and your friend that testified, her name that testified.
Jamie.
So her family, because of the cooling cot, was able to come from Texas
Yes.
and meet
Right.
the child,
Right.
and
Their
have
grandbaby.
take pictures and be together.
Take pictures, all of the things. And, and like I say to everybody, it's ultimately that family's choice. In the end, I have families that say, Kristi, I can't do that.
Right.
That's okay. We say, we honor you. We honor that decision. And then I have families that say, I want all the time. I want to do all of the things. Then, of course, I have families that say no initially. And then once delivery happens, they go, wait, can I still? And of course, the answer is yes. So you just want people to be able to make that decision. So that individualized care that we talk about in other arenas in the healthcare world, that's what's so important about this, is that you as a family are making your care decisions. And we are being supportive of you and giving you those options. I did a podcast with a mom who had a loss with us. Their baby had Turner syndrome, which is a diagnosis that typically is not compatible with life. And, what she said, which I thought was so interesting and yet just so picture perfect of what we do, is that she's like, I didn't know what I wanted, but they offered all the things that I didn't even know I needed. And that's the beauty of this, that we as healthcare professionals need to be prepared and say, I'm going to give you all of these options and you can choose all of it or you can choose none of it.
Right. Well, Kristi, for people in Louisiana, or even if they're outside of Louisiana, and maybe they're involved in a hospital, maybe they're just someone, the community who hears what you're saying and really is motivated to want to make sure that bereavement resources are available in their community. What would they do? What would you recommend them to take?
So,
how to take action?
I have, gracefully, I'm just so overwhelmed by the fact that so many people are leaning into me at this point.
Right.
What's the next steps? So what I say is reach out to me. I do have an Instagram. It's Bereavement Nurse Kristi. And I've had countless conversations of how and what is the next steps, whether it's statewide and national. One of our thoughts are, well, what happens next? There are 3 other countries in the world that have national bereavement standards. Our thought is, why wouldn't the United States be the 4th?
Absolutely.
And make a definitive choice for every family in the United States of America to now have a standard of care. If they're walking into a hospital and they have a loss, they know that they're going to get treated with the utmost respect and dignity for that loss and that life. And they can spend time if they want. They can make the memories if they want. And there never has to be a question of, well, if I go to this facility, will they have a cooling device? Will they not? So maybe I won't get time, maybe I won't. So, the easy answer is reach out to me. I've had many conversations with people around the United States of moving forward legislature that will change the picture and the landscape of what's happening in their state. The bigger thing is that we are going to push towards Congress and making change throughout our entire country.
Awesome. Well, that's important.
Yeah, it's so important.
Well, you've done all these amazing things, and you've been a leader for this cause. Well, there's one part of your life that we haven't talked about, which I guess we're going to go all the way back to at the end, we're going to go back to the beginning.
Yeah, okay.
So, and what I didn't even know until today is you were adopted.
I was adopted.
Wow.
So beautiful. I love the fact that my story just seems to always get, I tell people all the time, there's this, like Shrek. It's like the onion that keeps peeling back the layers and layers, right? I was adopted at 4 days of age. I was 4 days old, and my parents picked me up at, my story's a little interesting, at the back door of a hospital here in New Orleans. My mom was a teenage mom. She had my sister when she was a teenage mom, and then she got pregnant again. And she hid her pregnancy from her family. And, the story goes that when it was time to deliver, she tells her mom, I need to go to the hospital. And her mom says, for what? And she says, well, I'm having a baby. And her mom's like, what do you mean?
Wow.
They were a very big New Orleans family. And so there was lots of kids. So grandma didn't quite recognize the signs of pregnancy. So they go to the hospital, and my mom had already made a decision that she wanted to put me up for adoption. She recognized that she financially, physically, emotionally just couldn't keep me. And I thank her all the time for that. We have since met as an adult. I've met her, and she's a part of our lives. And I love the fact that she made that choice. She made that decision to give me up for adoption. And I am just so thankful for that, because I sit here now with you and I get to do such amazing things because she made that choice.
Wow.
Yeah.
That's beautiful. And that's real special. Clearly, God has anointed you for, as you say, such a time as this, to be a leader for this cause. And you're making your daughter proud.
Yeah.
Definitely. Angel is smiling down on you and is proud of all the amazing things that you've done. And I think probably since we're in the middle of your journey, I think, I think so. The tip of the iceberg so far. And so we just can't wait to see all the amazing things that you do for moms and babies moving forward in Louisiana and far beyond.
Yeah. We want to continue the conversations about maternal health in Louisiana. So that, I think about all the things that I do for bereavement, but there's the other side of it. And we need to do such a better job of educating our moms of how to make sure that we decrease the risk of stillbirth. And, that's why I've partnered with Healthy Birthday and Count the Kicks. So, I think this app that's out there is so amazing. As a labor nurse, I think about, forever we taught moms, if you get 10 kicks in 2 hours, it's all great. But what the studies now show is that not only are the 10 kicks are important, but the strength of those kicks are important. So this app that's free, comes in 20 languages. What the mom does every single day, around the same time, she counts her kicks, but then she tells the app how strong or weak her kicks are. And then it's intuitive, and it tells whether or not, if she goes, say, day 10, and there's a difference when she puts in this data, it will alert her that she probably needs to call her healthcare professional.
Wow.
And the thing about it is most of the time it may be nothing.
Right.
But in the off chance that it's something,
right,
we can save your baby's life.
Wow.
Yeah. So the birth of OBERs, that really changing the landscape of how we care for maternal health in this state. So it's just so important that we continue to push the envelope for maternal health here.
Yeah. Well, Kristi, thank you so much for being here today, and thanks for all your work. And again, we're just excited to see everything that comes forward from this.
Thank you so much.
Well, and again, just one more time, it's Bereavement, your Instagram.
Yeah, Bereavement Nurse Kristi.
Okay. So Bereavement Nurse Kristi. And we've been fortunate to have Kristi on. Look forward to working with you more in the future. Well, everyone, thanks for joining and watching today. Please be a part of advancing the support for moms and babies, especially through bereavement care. So thanks so much for being on today, and we'll talk to you soon.